So how does Asthma Brain help people prevent and predict asthma attacks?
We do so in a couple of different ways. One is we start with capturing data, environmental data, clinical data, personal data, from sources around the world, as many as 110,000 sites worldwide, as well as from hospital systems, payer information, and also personal inputs from the patient himself. And we correlate that data with what's called deep learning technology, one of the most advanced forms of artificial intelligence. Specifically, we look for patterns and correlations in that data that show us under what conditions a person is more likely to have an asthma attack. Those factors may include compliance levels or different kinds of medication and so forth. We can also then compare that person's conditions with people just like him and find people that are just alike but have different outcomes. And in that process, we can detect what is different about that person who is not having an attack or whose risk is lower, and in that process identify prevention options for that person who is having an attack. So we start at a very individual level, building what we call neural networks, but then we cluster those together into organic population clusters. So for a provider or a payer, for example, we can identify relatively large groups of people who are at high risk, and then people just like them who are at lower risk because they are doing different things, and then identify those different actions that can be taken to reduce the risk of the first group. In that process, we can not only predict the incident of attacks and potential hospitalization, but we can help the physician and the clinicians and even the patient himself take actions to avoid those attacks.